Module H, reproductive system. This is the system of our body that allows human beings to create a new human, and it can be subdivided into two categories, male reproductive system and female reproductive system. The female reproductive structures include the uterus, fallopian tubes, ovaries, and vagina. The male reproductive structures include the penis, testicles, scrotum, and urethra. As we said, this is responsible for producing life. It's also responsible for the production of reproductive cells and the hormones that are responsible for our sex characteristics. Normal findings: the absence of bleeding, and that's with the exception of menses, right? The absence of discharge, absence of pain and itching, and absence of the enlargement of the prostate. As we age, we do have a decrease in the size and function of our reproductive structures, enlargement of the prostate, as mentioned before, sagging breasts, loss of hair from the vulva area, weakened muscles that hold the reproductive organs in place, and we'll talk about prolapse in just a few minutes here. When we have variations from normal, these are again things we want to report: bleeding, pain, discharge, and itching. And now let's talk about that pelvic organ prolapse. So the female reproductive organs are held in place by muscles and connective tissue. The pelvic organs may drop down or prolapse into the vaginal canal, and there's a few different types. If it's a cystocele, that's when the bladder drops down. A rectocele is when the rectum has shifted forward. And a uterine prolapse is when the uterus shifts downward. When prolapse happens, incontinence may occur, and this condition can range from mild to severe. You can, if in more severe cases, see the prolapse organs hanging outside of the body. Women may do certain exercises, like you may have heard the word Kegel exercises, to attempt to strengthen and tighten that pelvic muscle to either prevent or aid in these types of situations when there's some prolapse. Our job as nurse aides is to provide peri-care as needed, and if you do report anything abnormal, to make sure to observe it, to report it to the nurse.